Hi, I'm Ruth O'Regan, Chair of Medicine at the University of Rochester. So the HER2 gene is very important in breast cancer because we have very effective treatment that treat cancers that express the HER2 protein. So pretty much all cells in the body express HER2. However, when we say a cancer is HER2 positive, what that basically means is that the cancer's got thousands and thousands of extra HER2 proteins on the cell surface. So there's two ways that we measure it. The first way is by looking at the expression of the protein using a test which is called an immunohistochemical test. And what that does basically is it measures the amount of HER2 protein on an individual breast cancer cell. So it can be 0, 1 plus, 2 plus, or 3 plus. Cancers that are 3 plus, which means they have a lot of expression of HER2, are considered HER2 positive. If a cancer is 2 plus for HER2, it means there's a chance it can be HER2 positive, but further testing it will be needed. If a cancer is 0 or 1 plus for HER2, it's considered HER2 negative. So the other way we measure the expression of, or we determine whether a cancer is HER2 positive or not, is by measuring the expression of the HER2 gene within the cell. And the most common way that's done is using what's called a fluorescence in situ hybridization test. Now, the HER2 gene is on chromosome 17. So in a normal cell, you would expect two copies of the HER2 gene and two copies of chromosome 17. However, in a HER2 positive cancer, what you will see is that there's more copies of the HER2 gene compared to chromosome 17. So Fish is commonly reported out as a ratio of the HER2 gene to the chromosome 17. If the ratio is above approximately 2, it's considered positive, and so you'll see ratios of 5 or above. That basically means that the cancer is HER2 positive. Now, unfortunately, it's not black and white. So we do have cancers sometimes that are what are called equivocal. And equivocal cancers will be ones that were 2 plus for the protein expression, or with the Fish testing, there's a number of kind of equivocal statuses. But usually, if the ratio is around 2 or so, that would be considered equivocal. We also now measure copy numbers of the HER2 gene. And if the copy number is more than 6, it's considered positive. If it's between 4 and 5, it's kind of considered equivocal. So sometimes your doctor will actually, have to do a number of tests to determine whether your cancer is HER2 positive or not. But as I said, it's very important because we have a lot of drugs right now that are very effective in HER2 positive cancers, including trastuzumab, pertuzumab, tucatinib, TDM1. There's a whole number of them, but they only work if the cancer is HER2 positive. So it's very important to determine whether a cancer is HER2 positive or not.